Thank you so much for coming. My name is Elaine Perry. I'm the director of the Richmond and Henrico Health Districts, and I am acting also as the board president for the Richmond and Henrico Public Health Foundation. So welcome to City of Richmond residents, to our Health Equity Fund partners and staff, to Richmond and Henrico Health Department staff, and to all attendees. We are so grateful that you could join us today to share in our celebration of the amazing work that's being done by the dedicated community-based organizations that will benefit from the Health Equity Fund. We are so excited to tell you about what the partnership has accomplished and will continue to accomplish in the years ahead. And now I want to welcome to the podium my friend, one of the Health Equity's strongest advocates, and the Mayor of the City of Richmond, Levar Stoney. Welcome.
Guys, give it up for Dr. Perry one more time. And Dr. Perry, I want to give you a big shout out for graciously and fearlessly leading the Richmond and Henrico Health Districts to ensure that all are safe in our community, and that you put equity and collaboration at the forefront of everything you do. Working with you over the course of the last few years has been a delight for me. And with 55 days left in office, I just want to say thank you. Who's counting though? I'd be remiss if I didn't also recognize my friends who are with us today as well. You know them from the Richmond City Council, Dr. Cynthia Newbill, and Councilwoman Catherine Jordan as well. Both fresh off of re-election. Congratulations, y'all.
Thank you.
Yeah.
Today marks another milestone with the Health Equity Fund, which further shines a light on lasting effects of the American Rescue Plan Act, ARPA. We established the Health Equity Fund in October of 2021, and through an initial investment of $5 million from the American Rescue Plan funds. And this fund was established to improve the health and quality of life outcomes within communities experiencing the deepest health disparities, communities that have long been impacted by racism and disinvestment. Most notably, our Black and brown communities have endured the brunt of inequitable choices and policies, and as a result, Black Americans have experienced illness at higher rates and have lower life expectancies than other racial and ethnic groups here in the city of Richmond. In a perfect world, no matter the zip code, no matter the color of your skin, you should have a fair shot at life.
Yep.
A fair shot to simply have the opportunity to thrive in the city of Richmond. But we know that is not the case. And during the time of uncertainty, the COVID-19 pandemic illuminated these historic disparities even more. I've heard time and time again, people say, oh, COVID-19 and the disparities. A reminder, COVID-19 did not create these disparities. These disparities have been around us from day one, unfortunately. However, through an infusion of ARPA dollars, we started this initiative to break the cycle that puts people at a disadvantage. To date, the Health Equity Fund has designated $3.2 million, including the funding announced today, to community-based organizations providing services in the following areas: access to health care and education resources, chronic disease and underlying health conditions, food access and security, maternal and child health, mental and behavioral health, and substance use prevention, treatment, and recovery. We focus the Health Equity Fund on those priorities because the data shows that these are areas where residents are struggling. And by no surprise, they also told us that these were among the priorities to see President Biden and Vice President Harris's once-in-a-generation ARPA funds used to address. And we listened to them, and we listened to the data. And Maya Angelou said, it's best when you know better, do better. And with this information, we're doing better and intentionally focusing on the areas where residents see they need the most. So the Health Equity Fund's funded partners make up a diverse group of community-based organizations committed to effectively addressing health outcomes in one or more of the 6 health disparity focus areas. And today we are here to announce $989,000 in new investments with 10 community-based partners who have already begun or will soon begin their Health Equity Fund supported work. Also, 3 currently funded partners will receive $388,000 of additional funding to further this work. So, please join me in recognizing the critical work that they do and that the City of Richmond is eager to see residents benefit from for years and years to come. So today's investments, let's begin with for the access to care area. Today's investments will be going to Health Brigade, Schaberg Foundation, Latinos in Virginia Empowerment Center, for our work in the chronic disease and underlying health conditions area. A grant will go to Community 50/50. In the food access area, a grant will be going to the Richmond Food Justice Alliance, Shalom Farms, for the maternal and child health area. A grant will be going to the St. Luke's Legacy Center. In the mental and behavioral health area, empowering you for positive change. The Hive Mentality, Virginia Anti-Violence Project, and in the substance use prevention, treatment, and or recovery category, Help Me Help You Foundation, Real Life, and Who Counseling Services. Now, the partners we'll hear more about today are poised to meet these needs and beyond by modeling what's possible when we invest in community-led work. Folks who are on the ground, grassroots, who have credit and a good reputation with the communities that they serve. Folks, the Richmond Health Equity Fund is the first, let me repeat, it is the first of its kind in the Commonwealth of Virginia. Today is another demonstration that this is locally led, and it's dedicated fund investing in health services and social supports critically needed in our communities. The awardees today, past and present, are making a difference, picking up where traditional healthcare organizations leave off, filling in the gaps. Unfortunately, so many of our residents have to navigate the gaps. It is good to see our city, in partnership with the health district as well, with all these community-led organizations, do our best to fill the gaps, to help that navigation. Just to be there to say, we care. And if we can ensure that a child born in this city, a black kid born in this city, in a zip code or census tract that unfortunately is under the poverty line, can live a longer, thriving life in this city, we will have done our job. We will have saved a life. Because that's what this is about at the end of the day, saving lives. And so our kids and our families can live and be strong. I have the great pleasure right now to bring my friend who knows a little bit about health equity to the podium, is my friend Dr. Cynthia Newbill. But before I bring Dr. Newbill to the podium, today is her 27th birthday. Oh, she said 37. That means at 43, I'm still older. And I normally don't do this, but we're going to croon out a little happy birthday. And so I will begin.
Thank you, everyone. I have to tell you that I have friends who have been chastising me about doing anything on my birthday. And let me say, this would be the only thing I would take the time to do something like this. As we stand here, as I reflected, Ruth and Amy, on data for our community in terms of life expectancy. You know about the stats, right? From this community just 5 miles out. And so this is not this is an important initiative in our community, and lives depend upon it. I'm going off script because, things I really care about, so I made notes. And so I'm going to try to keep to that, but this is, it's about life and living and life. So, as a member of City Council and joined by another member of City Council, Councilwoman Catherine Jordan, we know that the health challenges facing our communities are great. In fact, we still have too many dying too early and too often from preventable and/or treatable health conditions. The American Rescue Plan Act, known as ARPA, has afforded us the opportunity to take an innovative public health approach to investing in health improvement and health equity in our city. Using the federal dollars to establish the Health Equity Fund has allowed us not only to invest in services and projects like those that have been announced and you'll hear more about today, but to establish a mechanism for ongoing investment in the years to come, because that's what our residents deserve. These are not 1 year, 2 year kind of generational issues we're dealing with in terms of health and well-being. And it's going to take that kind of investment. I'm going to try to stay on script. The Richmond Health Equity Fund, as the mayor has said, is the first of its kind. And so I'm very appreciative of the mayor's leadership and my colleagues' leadership on council to support this effort in direct response to the data we saw. The COVID just put a light on incidents, prevalent occurrence across our city. What we've known, but it really shined a light on that. And it is a locally led, dedicated fund investing in, as the mayor said, gap-filling health services and social supports critically needed in our communities to strengthen health outcomes. And that's exactly what we're doing through the Health Equity Fund. We're addressing the health inequities that have been present in our communities for far too long. And in fact, as I said, these are generational issues, and it's going to take that kind of investment to really turn it around. And using the ARPA funds in the way we are doing in Richmond, we're putting Richmond on the map as an innovator and as a city committed to equity. But we're not going to stop with this work. We've built on the ARPA funds to create new public-private partnerships, which will be critical. And those partnerships are with local philanthropic organizations, with corporate partners, individual gifts, and yes, of course, sustaining funds from the City of Richmond through non-departmental funding. I just want to take a moment to acknowledge those philanthropic partners who've been on board with us thus far, and I don't know, can't tell if they're all here, but Atlanta Union Bank. Thank you. Natalia Artis, Robbins Foundation. Schaberg Foundation. Susan, yes. Okay. And the Community Foundation. I don't see Erica. Yes. I just really want to say thank you to all of you who have invested your time, energy, effort, and resources. I want to thank you for your past commitment, but I'm also thanking you in advance for ongoing support, because that's what it's going to take. Again, this is a critically important initiative in our city, and can't thank you all enough for leaning in. Our families, our communities, our children deserve it, and you've stepped up, and I just, again, want to say thank you. I'd like to, at this time, because I've gone way off script, I would now like to welcome our extraordinary Health Equity Fund Program Officer. You know her as Shalita Drawbow.
Thank you, Dr. Newbill, for being here on your birthday. Thank you all so much for being here. I am so appreciative of the opportunity to be standing amongst and collaborating with leaders who are so committed to making a positive impact. My name is Shalita Draba, and I am the Health Equity Fund Program Officer for the Richmond and Henrico Public Health Foundation, which is a nonprofit arm of the Richmond and Henrico Health Districts, or RHHD. It's an exciting time for the Health Equity Fund. There's been a lot of cheering, and I love it. We are actively seeking new community members for our Community Advisory Committee, which we refer to as CAC. The CAC, they play a vital role in our mission to promote health equity in Richmond. Together, the board and staff from both the foundation and RHHD work hand in hand with the CAC to select and identify partner organizations who will receive funding, and like those who are announced today. This collaborative approach and emphasis on centering and empowering the perspectives of community members is what sets the Health Equity Fund apart. The insights and experiences the CAC members bring, both lived and professional, they're invaluable to our decision-making process. They help us understand the complexities of health disparities and ensure that our funding decisions are informed by the real needs of the communities that we serve. Several members of the CAC will stay on, thank God, to inform our future funding cycles, but we're looking to add some more new members, and particularly those who have experience in maternal health, substance use, and food access. The application for new CAC members is live, and it will remain open through November 26th. If you or someone you know may be interested in learning more, the CAC and I will be hosting an information session on Tuesday at noon virtually, November 12th. I also have some flyers down on the front desk if you are interested, with the QR code that you may share with community members. If there are any CAC members in the room today, I would love for you to wave and be acknowledged, and I know there are a couple. Thank you so much for your continued collaboration and support with shaping the future of the Health Equity Fund. So as Mayor Stoney said, to date, the Health Equity Fund has designated $3.2 million, including the 13 partners that were announced today. The Health Equity Fund is excited to share that we will be making even more investments in the community in the coming years. We have recently concluded the 2024 application cycle, and new partners recommended by the CAC will be publicly unveiled in the spring of 2025, so stay tuned. Another round of funding applications will open in the spring of 2025 as well. This will provide an incredible opportunity for community members who are working to address health inequities to apply for Health Equity Fund resources. So to stay up to date on the application process as well as important deadlines, please be sure to follow RHHD social media channels, check out our newsletter, and also visit the Health Equity Fund website. Again, there are flyers everywhere in this room. So before we move on to our Q&A session, I'd like to encourage everyone to take a moment following our remarks to explore the poster display by the front door. These materials highlight the, thank you so much. These materials highlight the incredible work of each partner we are celebrating today. Many of these partners are here with us today, and I would love for them to come up and join us for the Q&A session right now. If you are willing, a representative from each one of our partners to come up who feels led in this moment to share about the health.
So my name is Zakia McKenzie. I'm the Executive Director and Founder of Nations Foundation. And this is our second round of Health Equity Fund funding, so I'm really pleased about that. This funding is really helping in the community, helping us to provide HIV and STI testing to people in the city of Richmond. It is also helping to have our mobile units out on the street offering food and other services to the community. So it's really, really making a huge, huge difference in the impact that we're making within the city of Richmond as it relates to health and HIV awareness and STD and STI awareness.
If they didn't have, this additional amount being announced here today, would you guys be able to keep doing that work, or would you have to kind of start limiting resources?
Well, the good thing is that I am a visionary and I think ahead. So all of my eggs are not in one basket, thank you, Jesus. But this is making a great impact. It's really helping, and specifically helping to do work specifically in the city. So it is alleviating some funds that we're using in other areas and making more concentration within the city.
Good morning. I'm LaShonda Singleton. I'm the case manager with Help Me Help You. We are a reentry nonprofit for individuals that are returning from incarceration. This has been huge for our participants. A lot of our participants come home with nothing. And so by allowing them to utilize the state services, they still always struggle with those little extra things that they need. And so these funds has allowed them to do extra things, like that one thing of maybe taking their kids to the movies, because the other funds are used for their bills and those important things. So extracurricular activities to build that family reunification that we strive for so much within this community. So these funds has really helped our participants extremely. And I just say thank you.
Good morning. Good morning. Well, I want to say peace. How y'all doing? My name is Zenobia Bay. I am the CEO and founder of Community 50/50. We are a grassroots organization that focuses on youth and family engagement. And in 2009, actually 2012, we started a third Sunday feeding, just based off a need. Partnered with the organization Friends of the Homeless. And we started in Blackwell, and when COVID hit, actually the numbers went down. So from 2009 to 2020, the numbers actually went down in 2020, so we moved to Jackson Ward. Jackson Ward, we actually followed the lead of one of our ancestors that passed away, Sister Lily Estes, and she taught us about inclusion. And so we partnered with the residents in Jackson Ward and said, can we come on your lawn and actually feed the community? And with that access, we were able to engage with community members directly, hear what they need, hear what families are going through right there at their moment, and so it allowed us to connect with other community partners and say, hey, we need to make this consistent. And with this funding, it allows us to elevate it to health fairs. So now with the health fairs, we can bring licensed clinical social workers, we can bring nutritionists, we can bring certified individuals and expertise in their area to come and actually provide a direct need, and then follow up with weekly wellness checks. So thank you, appreciate the city for seeing everybody, seeing us, and continue to do the work. Yeah.
Buenos días. I'm Elvira de la Cruz. I am the CEO of Latinos in Virginia Empowerment Center. And we will really struggle because even though we are a domestic and sexual violence programs, that is what we are supposed to be doing, we're receiving a high amount of call from a Spanish-speaking community from the city of Richmond. And our helpline was not able to serve them. And with these funds, we were able to hire one helpline specialist that is going to help the navigation and access for these people that doesn't speak English. Thank you very much.
Hello, I'm Omar El Khadafi. I'm the founder of Richmond Food Justice Alliance. My daughter cheering me on. But with this funding, Richmond Food Justice Alliance had acquired a vacant city lot in the East End in 2021, and we partnered with the community and Community 50/50 to engage the community and see what the community exactly wanted to do with this space. Of course, our organization, we've been doing urban agriculture, health equity, community engagement since like 2017, and food policy in the city. And so that was a goal of ours, but we did want to, ask the community exactly what they wanted to see. So I think the great thing about it is that the people that have been on the ground for years doing the work, or people that have just cared about their community and lived over there in Mosby Court and cared about their community and wanted to do things for it, like those people are now receiving the funding. Like, so we are employing the people in the community. We're partnering with other small grassroots organizations that were on the ground along with us a few years ago, you know. And so I think that that's the biggest thing for me, the biggest transformation that this award comes with is just supporting everyone who's been on the ground doing it, and community members. And I really love the structure of the way that the funding is going. You know, the way that the foundation was created kind of takes a lot of the, you know, the political stuff out of the process that may be there in other forms of funding. So I really appreciate the funding opportunity and just the partnership with the health department.
I guess I'll pop up here. Sarah Scarborough, I'm the director of Real Life. We have 11 recovery houses here in the city of Richmond, and we are very blessed and fortunate to be funded for the second year. And these funds truly, truly help us enabling everybody to move in free of charge. We get a lot of folks coming from reentry that have absolutely nothing, and so many programs cost to get in, and that really limits folks' ability to access safe, stable recovery housing. And so these funds are very significant in allowing us to have everybody move in for free. So thank you, Mayor, and everybody else.
Hey all, I'm Anna Ibrahim. I'm the Executive Director of Shalom Farms. We grow and distribute food here in the City of Richmond, in the North Side, and the South Side, and the East End. And the way that we distribute that food is through a mobile market program. These are markets that show up every single week from late April to early December and sell food at an incredibly discounted rate because of generous funding provided by both foundations and individual donors. This funding specifically has allowed us to grow food earlier so we can start those markets earlier, and grow food for longer so we can extend those markets later. And it's allowed us to add markets to evenings and weekends so that we're able to reach more working families as they're getting off of work, and put those markets in more public places so we're able to reach more folks in the city. We serve about 10,000 people every single year, and this funding is instrumental in making that possible. So, thank you.
Hello, my name is Latasha Boone. I'm with WHO Counseling Services, and we provide substance use disorder services for those who are just being released from incarceration. Oftentimes coming home, they have no resources or even know how to even apply for Medicaid. So we have a case manager that's assigned that can walk them through the process. I'm glad to see a room full of community organizations. They're looking for employment. They're looking for ways to feed their family, and oftentimes they lack the support. And what WHO Counseling does is just walk them along the way until they're able to acquire Medicaid. And if anyone has been through that process, it can take anywhere from 45 to 60 days. Imagine being out here in the community and not having access to health care. So that's where we come in. And I want to say thank you. I saw Shalita when I came in, I was like, I want to thank you for all the support you've given me, because I was like, I've never done this before. Was I really helping? I said, yes, you were. Yes. So I want to say thank you for walking me through that process, and it has made it smooth for someone who's never done it before. So thank you, and I appreciate the funding. Yes.
You see, you don't give community members a mic and expect us to be quiet. So, hi everybody, my name is Trey Hart. I'm the co-founder and managing director of The Hive, and we're a new nonprofit in the region with a goal to build a physical campus that'll help young people transition into adulthood who typically get wrapped up in the legal system and the child welfare system. So we're new, and I think to answer your question, what's helped us is that the Health Equity Fund represents innovation in our city, and so we are doing an innovative case management process that's healing centered and offering another alternative for young people in the community to transition transition into adulthood, and which has been really vital. And I think having a government agency believe in an early stage project has been really helpful and not very common, so I really appreciate that. It's helped us leverage other funding and really cement our foundation as we're growing something from the ground up. So thank you so much.
You said new. How new are you guys?
We were launched in the end of 2021.
Okay, so you've been getting the funding since so right when this started.
Yep, exactly. And
wow.
and we've been doing our staff, which includes Anise White, who's over there, who runs our Young Innovator Squad. Have been working in the community in various forms for many years, and so we all came together to launch this. So we already had a little bit of knowledge and reputation in the city, so it's helpful to have funding, then back up some new ideas. Yep.
Okay.
Sorry. Last but not least, I'm Corinne Waikato from the St. Luke Legacy Center, so welcome to our space, everyone. If you haven't already been here, I'm really glad that you all are getting the opportunity to see and feel the space here. We believe that you can feel Miss Maggie's spirit and her legacy here. So we were created to create a community center that can bring community partners like ourselves together to create wraparound programming that meets the needs of an entire family from birth until death. Those wraparound supports being culturally competent, specific, sensitive, and holistic in nature. And so we do a variety of monthly community events and programs, and Health Equity Fund, thank you, for giving us this funding to do our 4th trimester program. So we are specifically focusing on Black and brown moms out in the postpartum period, which is super critical. And not only moms, but dads, because often we see programming that leaves dads or partners out of the programming and out of the talk, the conversation. But one of the really interesting statistics that we saw was a lot of the mortality is after the birth of the child, where homicide, domestic violence, things of that nature, which speaks directly to the impact that postpartum period can have on a new dad. And so we're doing, my licensed professional counselor here, Chief Clinical Officer Nikki Shaw. We're doing free postpartum depression, anxiety, all different mental and behavioral health screenings for both mom and dad. They get 3 outpatient therapy sessions that can be used flexibly, as well as 24 hours of free postpartum support with doulas, postpartum doula support, where they can come in the home, do overnights, and do all different types of support, which we got. And these things aren't typically accessible or affordable to people in our community. And so, yes, we are really grateful. This is our first year, first round of funding, and we're thankful. Thank you.
Awesome.
Hello, everyone. I'm Al Waco Sumner with Empowering Youth for Positive Change. I'm the Director of Operations, and I'm not supposed to be speaking because my business partner is out of town. We're a mental health agency, community mental health agency in the Richmond and surrounding areas. We work with children and adults, and this grant actually will help us gain more access to individuals in the community, because we do a lot of pro bono stuff. We help them, find housing, clothing, food, employment, and if we can't help, we point them in the right direction for help. So this will help us gain a lot of access to people that need help, and I'm on the ground. I'm out there every single day, so I see the need, and I love helping people. So, thank you.